Facebook site and our website. So we have a lot of great information, a lot of great things that are going on. So as we get started, as everybody comes up and grabs a seat, and could you please put your phones on silent? We've got some beautiful, fantastic presentation today from 211. So how's everybody doing? Did you have cookouts this weekend? Did you eat too much? Did you drink too much? Did you party too much?
They only put so much beer in a can.
He says they only put so much beer in a can. They sell more cans.
They sell more cans. It comes in a case.
We can.
And bigger.
Okay, very exciting today. I'm really happy to see all these beautiful faces, you know, especially where it's a holiday week. We understand there's a few meetings that went on recently, and they were very, very narrow on attendance. And, you know, here we have most of the chairs filled. That's fantastic. So we got a lot of things going on. Christine will talk about it. We got a great presentation today. And one of the things I want to talk about is the technology side, and it's getting easier all the time. So to have us grow, you know, us being Church Goes After Seniors, being a 501c3, and looking for donations and put the word out, that it's very easy. So we've been testing, Mary and I have been testing a few things, like for instance, he says, okay, I'm going to put this thing, and it's free, you can come to these meetings, so I'm going to put it on Nextdoor for free. So she did that 2 days ago. Now, so these people now, with this technology, the elderly people can see it at home, so you don't have to get out of their bathrobe. They can stay in their bathrobe on the lanai and watch this. And so she put it on a couple days ago, and there was 632 views. So that advertising for free, it's under free and Nextdoor, and I believe it's in 7 communities. So could you imagine if most of us shared stuff like that? Could you imagine how many people we'd get to? It'd be phenomenal. And with that, we have all these businesses that are tied to this organization that give services to our seniors on the Treasure Coast. Of course, you want to check that out on our website at treasurecoastadvocacy.com. You can check it on our Facebook site. We've been adding things even through last night. We had a meeting about one of our events that are coming up. And we'll get a chance to talk about that soon. And so there were ideas, and like by 10 or 11 o'clock last night, I was working on some of that stuff to help some of the exposure, like the 501c3 and so on and so forth. We're adding that information last night and this morning. So please, you know, share our stuff. It only takes a second, and some of those areas you can share it to in like a couple of clicks. It takes a matter of seconds, not even a minute, not 5 minutes, not 10 minutes. So real excited today. So happy to be here. So I'm going to turn this over because, you know, we got one of our staples and our part of our foundation and our pillars, Catherine, right, Griffin, that has been around for a few years. And she's going to talk about a lot of things this morning. And hopefully, if you're out there in the world watching us, again, good morning. Get yourself another cup of coffee because we're about ready to start. There you go, Catherine.
Thank you, Tom. Good morning, everybody. Morning. I'm going to give a little bit of our mission statement and how we founded Treasure Coast Advocates for Seniors, and then I'm going to read chapter 5, and I'll let you know what's coming up for meetings. So the mission statement of Treasure Coast Advocates for Seniors is to provide healthcare, financial education, counseling, and assistance on the Treasure Coast. TCAS, as we call it, was started back in 2008 when Mona Gwynn Huff, Kim Nelson, Gil White, Pam Springer, Kathy Blackman, and myself decided over coffee to help our seniors on the Treasure Coast. Nancy Hannon, Leslie Bestrich, and Lee Bareilles, others joined the board shortly after. Since then, Mona and Gil have passed, and we honor them with carrying this torch of assisting seniors on the Treasure Coast. We're all volunteers, and each of us have regular jobs, but our commitment is to help seniors. In the past, we've helped seniors with their air conditioning needs, carpet cleaning, pest control issues, and even pet supplies. If you know of a senior in need that needs our assistance, please speak to one of our board members so we can assist. Our meetings are here every last Thursday of the month, except for November and December. We're always looking for new members, and you can join on our website, tcadvocates.org. So this past week, we, as our group, purchased a refrigerator for a senior in Fort Pierce. And I'll tell you, when you go and do things like this for someone, it just tears your heart apart to see the conditions people are living in right now. So be proud that we're doing such great things in our community to help our seniors. That's what we're here for. If you're a member and you haven't paid your dues, please do so, because this is how we're able to help everybody. We need our members to pay the dues, and if you're not a member, please consider joining, because it's not real expensive. You can go on our website and check it out. So for coming up meetings, we have Dr. Vassar with Healthy Eating for Seniors. Our coffee sponsor is Aqua Homes here for June. We've got July, Michelle Franklin, our St. Lucie County property appraiser, and our coffee sponsor is Aviva and Daniel Buck. In August, we've got DCF, Tangela Brown. Speaking of abuse, neglect, and exploitation in the vulnerable adult population, our coffee sponsor is Senior Helpers. Thank you, Jeff. In September, we have Dr. Rains, and he's sports medicine with Florida Orthopedic Specialist. And Molly's House and Elder Care Services are sponsoring the coffee. In October, Matt, you've got a doctor coming in, right? Pulmonologist. And we need a coffee sponsor for October. November, we have no meeting because of Thanksgiving, and December, we have to have our holiday party here. So without further ado, I'm going to read Chad's professional bio. Chad Adcock built his life and career around the principles of loving and serving others. His career began primarily working with young people through a variety of nonprofit organizations in capacities such as minister, educator, coach, and camp leader. In 2012, he began working with older adults in the senior living industry. He has held roles in assisted living facilities, home health care agencies, and in the hospice setting. He has spent more than 20 years in leadership, management, and sales. Chad knows what it takes to generate a proven track record of success, and more importantly, he thrives in coaching and leading others to achieve organizational success as well. He has served as a board member for the Treasure Coast Advocates for Seniors and is a current board member of the Inner Truth Project. Chad holds a Bachelor of Science in Business Management from the University of Alabama at Birmingham and a Master's of Divinity from Stanford University Beeson Divinity School. So let's, without further ado, let's welcome Chad and give him a great big applause. Thank you, Chad.
That's always a little embarrassing, isn't it? I have somebody read it, trying to do. But, yeah, so I always like to start my presentations by asking, prior to coming here, how many of you are familiar with 211 kind of services? So that's good. That's a good percentage. The reality is that some people still have never heard of 211 services and aren't familiar with what it is that we do. So ultimately, I would love to be able to say that everyone that I encounter is aware of what we do at 211, but not everyone is. And so that's, that's what I do, is to try to continue to spread that message. Ultimately, I would love to work myself out of a job so that everyone has those resources that are available to them when they need them. So what is 211? 211, there we go. And I don't know why that those eyes are white like that. It just some kind of artifact came over in the rendering or whatever. Maybe it's so that you guys will remember this presentation. You'll think about, oh, it's that guy with the weird eyes. Not eyes, EYE, but not the letter. In the nonprofit world, I always think about it as your vision statement is what you would like the world to look like, and then your mission statement is what are you doing about it. So For 211, the idea is we would love to live in a world where the resources are there for people to get or the information and the resources are available to those that are going through a crisis, whatever that crisis might be. And if you're not going through a crisis right now, congratulations, but you will. That's the unfortunate nature of life, is that, you know, like the Buddhists say, all of life is suffering. Eventually, we're going to go through something. We're going to go through some kind of situation. We don't know where to turn to. And that's the world that we envision at 211, is to have that information and that resources that are available to that person. Another way that I like to liken it is to your windshield wipers on your car. If your windshield wipers on your car need replacing and you don't know that, and then you're driving down the interstate and a monsoon storm comes, now you're in trouble because you can't see where you're going. So we're like those windshield wipers in that storm, which takes me to the mission of our mission is to save lives. You think it's a helpline and a crisis line, how are you saving lives? Well, we do that through a lot of ways, and I'll talk about each of those as we go through this, but we connect people to all of the different resources that are available, whatever that might be. A lot of you here do work in the mental health space, the well-being space, or whatever it might be. We want to be able to provide those resources to those people that are going through those situations so that they know where to turn to. And also a whole series of advocacy programs that I'll touch on as we go through this, and how we're actually making a difference in people's lives and actually saving lives. See, I told Tom that I was a Luddite. I don't like technology. I want to go back to the way the world was in 1993. Anyway, I could go off on a tangent, I won't. So how do you reach 211? It's easy. You know, people ask me all the time, and many of you know me, that I used to be in healthcare sales, and, you know, I do these tabling events and things now, and people come up to me and they're like, all right, what are you selling? You know, they got this guy in this suit, what are you selling? And now I can tell them nothing. I'm not selling you anything, because it's wonderful. What we're doing is providing a free service to anyone who needs it. And whatever it might be, you can simply reach out to us and call us. You can call the 211 number. You can text on your phone. And if you be so inclined, you can go online to the website and chat with a live representative. There is actually even an app that you can use. All of those things are available. Here, I'm just going to put the arrow. Boom, there we go. All right, so the resource directory, I was talking to someone earlier about the resource directory. What that is we have about nearly more than 2,000 different resources that we utilize for the residents of the Treasure Coast and also of Palm Beach County. So I didn't mention that our 2-in-1 program covers the 5 counties of Palm Beach, Martin, St. Lucie, Indian River, and Okeechobee. I cover, you know, one of the things that I do is the outreach is to cover those 4 counties of the Treasure Coast. I have a colleague that does Palm Beach County, as you know, the numbers there are equivalent. So the resource directory covers the resources in those counties. You can go onto the website right now, and at the top of the page, there's a button that says Get Help Now. Click on that, and then you're connected to the database. Now that database is the same database that is used by the resource center specialist if someone were to call and say, hey, you know, my rent's going up this month, are there resources available? And I live in St. Lucie County, or I live in Indian River County, whatever it might be. So you can go right there, it's easy to use, it's frequently updated, and I know some of you are familiar and are already in conversations about the community resource guides, those one-pagers that we have for every county. We're in the process of updating those things again. I don't personally enjoy those documents because as soon as you print them, they're out of date because the organizations change. They change the services that they offer. Plus, there's only so much you can put on a 8.5 by 11 one-sheet page. What is updated, and then it's resource expensive to be able to do that. The cost of printing those things is expensive. You know, you think about, I don't know, there's a bunch of them out there in the lobby now. Think about having to print those for all 5 counties and all of the different resources that want them and the costs associated with that. What I try to encourage people to do is to go to the website, to go to that database. If you're looking for help with rent assistance, if your mother is aging and you don't know what to do, now you're suddenly experiencing dementia symptoms in your home or with your family, you don't know what to do. There's a whole database of resources. You can break it down by zip code. You can break it down by county, whatever it might be. You know, if you want to search for whatever resource or whatever situation you might be going through, the database is the place to go. One of the things that separates 211 from other helplines and crisis lines is that everyone that works in the resource center is an employee. They are highly trained and they spend multiple hours, in fact, at least 100 hours of training before they ever are allowed to answer the phone. That's not to say that we don't utilize volunteers, we do, but not for the resource calls. And the reason for that is we might have someone calling and saying, hello, my rent is going up this month. Do you know what I can do? They might also, and the next call might be someone saying, my child is 3 and isn't saying, I don't think they're saying enough words. Is there anything that you can do to help? And the next call might be saying, my mother is starting to wander. Are there resources that are available? And the next call might be saying, I have a gun to my head and I'm ready to end my life. So our resource center specialists have to be able and have to have the skills to handle all of those situations. You can imagine that's a very tough task. So it's not somebody that you would just want volunteering their services to do. These are highly trained employees. They go through rigorous hours of training to be able to handle those types of calls. And there, you know, there's all sorts of role playing that's involved, shadowing and buddying situations, and every single call that comes into our resource center is recorded, which is important. Just like 911 calls are recorded, all of our calls are recorded, so that we can go back and use those for training purposes, so that we can say, hey, you know, we noticed that you gave 2 resources for this need. Maybe you could give 3. Maybe there's another one out there that you can do. So all of that stuff is important to the database. This doesn't probably mean a lot to you guys. It kind of goes, it hints a lot at what we're talking about. What I was talking about earlier is that all of our stuff is accredited. All of the agencies that we use are there in order to be able to handle those suicide calls. You have to be accredited by the American Association of Suicidology. You have to be accredited through what used to be called FLAIRS, the Alliance of Information and Referral Systems. All of that stuff is important to us, and it's important to the funders. So what happens when you call? The first and most important thing that we do is listen. Listening is the most important thing. And in fact, all of our resource center specialists are trained on the art of listening. Because it's not our job when if someone is reaching out to us, it's because they're in a desperate situation. They have a need that they need to be addressed. It's not our job to say, oh, your rent is going up. Maybe you should have done a better job of planning. You know, maybe you should have done this. It's not on us to judge that person at that point. Our job is to listen, to meet them where they are, and then to provide the resources that are available for that to help them. We're not there to try to correct their behavior. We're trying to help them get through this difficult situation. To empathize with them, crisis counseling. Like I said, if someone calls the National Suicide Prevention Lifeline on the Treasure Coast, those calls come to our office. So in that situation, someone could call and say, I'm feeling suicidal. I'm standing on the bridge. You know, I don't want to continue this life anymore, whatever it might be. We have to de-escalate that situation. And if the person has motive and means to end their life, then we would get the authorities involved, get the law enforcement involved. One of the things that I do is trainings for the crisis intervention trainings for the law enforcement, the interagency law enforcement, that we do those several times a year. And, you know, I always explain to them the same thing, that we want to be that person that is, or the agency that's there to provide that non-emergency services so they can do their jobs and provide real law enforcement. And then, of course, obviously the sharing of information and resources. along with 211, and I'll kind of go, I mentioned this already. So to kind of give you a background of the National Suicide Prevention Lifeline, it was started in the early 2000s. And Congress created this program for people to be connected to resources. So if they were to call wherever they are in the country, you can call this number and get connected to local agencies to help you. If I'm feeling suicidal, I can call 1-800-273-TALK and speak to someone right now. I don't have to try to get into a mental health counselor. I don't know if any of you have tried to reach out to a clinician to try to get an appointment for therapy, but sometimes now that can take you weeks or months before you get in front of someone. If you're feeling in a crisis right now, if you're actually actively suicidal, you can call and speak to someone right now who's trained to be able to help you. So that number was started in the early 2000s, 1-800-273-TALK. And then in around 2022, the Congress got together again and decided, hey, that number is really hard to remember. Who remembers a 1-800 number? I don't remember that number. I only remember that number because I do this presentation. Actually, that 1-800-273-TALK and then my wife's phone number are the only phone numbers I remember. But who would remember that if they were actively suicidal? So they decided to come up with an easier 3-digit number to remember. Now 211 campaign to have 211 be that number because we're already answering those calls anyway. But the reason why Congress chose to create a new number separate from 211, and that number is the 988 number. You may have seen that number on billboards and advertisements and things. I saw a commercial for it during a NFL playoff game. So the number that is now out there is the 988 number. The reason why it wasn't chosen as 211 is because even though we are the National Suicide Prevention Lifeline Crisis Center in this area, not every 211 across the country is. So a person might have dialed that number and then had to be transferred to somebody else, and that's the last thing you want when you're in an actively suicidal situation. So they created this number. So I say all that to say that our program, the 211 of Palm Beach and the Treasure Coast, has been the crisis line and helpline for people of the Palm Beach and Treasure Coast for more than 50 years. So we've been answering those crisis calls many, many, many years before the National Suicide Prevention Lifeline was ever invented. So it doesn't matter. You can call 211 or 1-800-273-TALK or 988, and you're still going to get connected to the same resource center specialist. I won't go through this. These are just some of the different expanded programs that we do. I kind of hinted at this. I like this. Those of you that can see that far away, I'll read some of those examples of help requests. Some of the things that we get. My rent just increased by $800. How can I survive? We get those kind of calls a lot lately. My food has run out and I can't afford my medicine. A lot of times, I'm sure some of you have experienced some of your clients that are seniors having to make that choice. Do I get my medicine or do I get food? That's a sad situation to be in, but it is one that exists and there are resources that are available. My older son is struggling with substance abuse. I'm worried that my child isn't developing properly. And these are all actual, real calls that we get on a regular basis. I want to talk about this, the mental health crisis, to kind of highlight what we're talking about. As far as as far as I'm concerned, that's our number one type of calls. In fact, somewhere in the neighborhood of 40 to 50% of all of our calls have a mental health component to them. It might not be the only thing they're calling about, but they're also experiencing some type of mental health. They call this the third wave of a crisis, the mental health side of it, whatever it might be. And I don't know when the pandemic started, who knows, but somewhere around 12 to 18 months afterwards, and then existing for a number of months and even years after that is what they call the third wave. First, you have the actual crisis itself, then it creates an economic burden, and then after that is when you experience the mental burden on top of that, and that's where we're at right now. Everywhere I go, everybody I talk to, the mental health concern is tremendous in our area and across the country and across the world. And there just aren't as many resources to meet the needs that there should be. We know that younger people essential workers, which all of you are, those of you that worked through the pandemic, we all did that. We're all experiencing those at a greater amount. And also adult caregivers, and I'll talk a little bit about this in a second, but those people who are caring for a loved one, already that has a tremendous burden on top of it. And then now having gone through that with the uncertainty of living through a pandemic was very difficult on those people, and they're experiencing that even more. Mental health disorders and suicide. And I say to say that we are the National Suicide Prevention Lifeline call center, and we do handle a lot of those crisis calls. And there is a misnomer about suicide. Some people are like, oh, Jared, you shouldn't talk about suicide, because if you talk about it, you're going to push people to die by suicide. That is 100% not true. In fact, the more you talk about it, the less likely people are to go through that process. Because there's another misnomer is that people that die by suicide, they want to die. That's not true. Most of those people do not want to die. What they want is the pain that they're experiencing to end. Whatever that pain is, and it could be anything from physical to mental to spiritual, whatever it might be. They want that pain to end, and they find that the pain is so extremely powerful that they want that pain to end so bad that they're willing to give up their life for the relief of having that pain end. And talking about suicide had the exact opposite effect of pushing people towards it. In fact, talking about it allows people to experience and understand that their life is valuable and has meaning. And that, yes, this is painful right now. What you're going through is very hard, but things get better. You're not at fault. You didn't do anything. And even if you did, you can improve yourself to get better. So talking about it is not a bad thing. And I'll just share a personal anecdote. My wife's best friend from middle school, they still speak to each other. She called her a year or so ago and was like, hey, she was going through some marital problems and some financial problems. And she told her that she was feeling suicidal. And my wife was like, oh, that's just her. She's always dramatic. I'm like, no, you can't do that. You can't just write that off. I'm like, you have to ask her every day. Call her every day and say, how are you feeling? Are you feeling it? Are you feeling yourself? And I was like, she was like, well, how long should I do that for? I said, until she makes it obvious that that is no longer an experience that she's going through. I want it to be annoying to her that you're calling her and asking her how she is. And she did, and she's fine now. We all go through those burdens. We all go through those difficult times. The vast majority of us will experience some type of mental health struggle during our life. You can see there's that concentric circles there. Those who have struggled with a mental diagnosis overlap with those who have died by suicide or attempted to die by suicide. Very few people who have a mental health disorder or have a mental health struggle are going to die by suicide. Even though the two things do overlap, just because you have a mental health struggle and a burden doesn't mean that you're going to be suicidal. In fact, very few people are. And talking about it is important. These are just, I know you can't read that from that far away. I couldn't read that with a giant magnifying glass, but just to kind of give you some of the numbers of what we're talking about. Because sometimes I'll talk to people and they'll say, oh, 2 and 1, you guys must handle like 4 or 5 calls, right? No. So from January, and these are numbers from a couple of years ago, but from January to December, so 1 year of calls for the Treasure Coast, we got nearly 20,000 calls. Those numbers are increasing, obviously, and I need to update this presentation for the numbers from last year. In fact, it's probably closer to like 25,000 at this point. And a lot of those, you can see total number of referrals. What that means is when someone calls us and we give them information about an organization to help them with whatever they might be going through. Despite my fear and hatred of technology, those numbers are increasing. The database online and the mobile app visits is going up versus a lot of times people don't want to call. You can, especially if you're going through a mental health struggle, you don't necessarily want to call and speak to someone, even though you can do so anonymously. It's easier to do that even more anonymously through the anonymity of your computer or your application. So if you want to, you can go onto 211 counts. If you go to 211counts.org, if you're wondering, like, what kind of information is out there, what kind of topics are we seeing, what are the struggles that are going on in our community, you can see that in real-time data. And you can, again, search that by area code, zip code, whatever it might be. Housing requests, so the things that I'm seeing, substance abuse, obviously still going on. Opioids are a tremendous concern and have been for a number of years and will continue to be. Substance abuse, mental health is obviously the number one, and then housing being number 2 or 3 between the two. In San Luis County alone, 26% of requests had something to do with substance abuse. Healthcare concerns, those were physical healthcare were very prominent during the pandemic, and then now we're starting to see that replaced with obviously the mental health side of it. No, you can't read that. Again, grant assistance, people looking for emergency shelters, transitional housing, low income, subsidized private rental. Some of the things you might not be aware of that we help people with sometimes if they're about to get evicted, we have motel vouchers. So someone can go and during their transitional period live in a motel. And that's, there are resources that are, what I'm trying to say, there are the resources that are available. Whatever a person is going through, it's our jobs to try to provide them with the help that they need. Some of the expanded services, that's not really what I want. The advocacy programs. So this is the one that I brought these flyers for. There's some up here and there's some in the back too. This is one of my favorite programs, is our Sunshine Daily phone calls. And the Sunshine, and this, it's probably my favorite because of my background working with seniors. So the Sunshine Daily phone calls is a program that we have, an advocacy program for anyone over the age of 60. And what they can do is get a free daily check-in call just to make sure that they're okay. Just to make sure that they're doing okay, that they've had their food, that they've had their medicine, that are there any needs that they need to be met. And, I joke with the leadership at the organization all the time. I'm like, I'm 15 years away from being 60, but I want a free daily check-in call. I want to open this up to everyone. No one calls me and is like, hey, Chad, how you doing today? But that would be great. But the point is that it's available to those age 60, because we know, those of you that work in the industry know that there are a lot of seniors here that don't have family, that don't have friends to check on them. And so what a great resource available to them to be able to just say, hey, this program is there. You can sign up for free. It won't cost you anything, and you'll be able to determine or have someone call you just to make sure you're okay. And just to kind of give you an idea of how this program is life-saving, this is a real situation with one of our Sunshine Call clients in Indian River County recently. So the way the program works is you get signed up and you get a phone call at your preferred time. If you don't answer that day, then after a given amount of time, we'll call back. If you don't answer again, then we reach out to your next point of contact, and that person can't get a hold of you, then we'll do a wellness check through law enforcement. So we had a lady in Indian River County who didn't answer her daily call, even though she always did. So the given amount of time went by, we called back, she still didn't answer. So we reached out again to her next point of contact, which happened to be her neighbor living in her community. She went over to check on her and found that she had fallen in her bathroom overnight and probably would have laid there and died. So this program is free, it's amazing, and it really is saving lives. So if you work with seniors, I would encourage you to have them get signed up. Even if they're working or living in a community where there are other people around, it's still a great service to have. And the program on the opposite side of these is available to a caregiver of a senior too, because as we know, if you're a caregiver of a loved one, especially a senior or aging loved one, if they're developing any type of cognitive issues, those people, the tendency is that if they don't get help, they will predecease their loved ones. So having that daily check-in call on anyone who is also caring for someone is a wonderful thing as well. Other programs that we do, and I'll briefly hit on these. I wanted to talk about specifically the Sunshine Call, because I know that most of you in the room obviously work with seniors. So those are the ones that are most important. Another one that could be important to you and your clients is the My Florida Vet. We have a veterans liaison who works directly with veterans to make sure that they're getting all of the benefits that are available to them. That could be either through the VA or outside of the VA, because there are benefits outside of the VA as well. So if you have veterans that you're working with that are clients and they, you're not sure what resources are available, our veterans liaison works directly with them. And then a couple of other ones that work more with younger people, our special needs helpline, and also our Help Me Grow program. So the special needs is similar to the veterans program in that we work with anyone who is a caregiver or as a family that has a person with special needs in their family. We make sure that all of the resources that they need to help them in that situation are there to help them, whatever it might be. Like I know an elderly couple, they recently moved out of the area, but they were an elderly couple who had an adult son that lived with them with special needs. So in that situation, the resources that are available to them, and whether that be social workers or whatever, to help them in that situation was something that I always encourage them to get signed up for. And then Help Me Grow briefly, because I know you don't work with young people, is for parents with developing children ages 0 to 8, just to make sure that they're developing in the right rate. Are they saying the right amount of words? Are they making the right amount of steps? If not, we can help them get connected to those resources. Other things that we do during tax season, we just did this. We work with a lot of the United Ways to help provide free income tax preparation for those that qualify, summer meals, back to school, flu season, all types of diabetes and awareness. And unfortunately, as Saturday is June 1st, we're going to enter into hurricane season. So anytime there is a hurricane coming, we are the National Disaster Helpline. Those calls come to us as well. If anybody is looking for shelters or whatever it might be, we're able to provide that. So just to kind of wrap up, it is free, it is confidential. Now we obviously do track data on our clients. That's how I give you all that information. But if somebody wants to call us and say, I don't want to give you anything, I want to be Ronald McDonald or whatever, you can make up a name or not, you can be 100% confidential and just talk to somebody. If our priority is helping that person versus gathering the data. If it's a situation where we can't get that information, we will, but if not, you can be 100% confidential. It's available 24/7. There's no holidays at 211. There's live resource center specialists that are answering those calls. And we connect people to all across the Treasure Coast and Palm Beach County to get the resources that they need. We have a crisis intervention. If somebody is in a crisis situation, we connect them to all of the programs and services and to de-escalate that situation. And then obviously the most important thing is just someone to listen. Someone to listen to whatever situation you might be going through. And just to have someone to talk to. You can call it right now. You can get in the car and say, hey, you know what? I had a really terrible day today. I tried to do all this for somebody and nothing that I did seemed to work. I need somebody to talk to and I need somebody to vent to. And you can call in and have that conversation. Any questions? There's my contact information is in there. Yes. In the back.
The daily call, if it's specific, I have a lot of requests where they cannot afford, obviously, the daily visit for medication reminders. We just go in there, give them medically. Do you guys do specifically medication reminders if that's all we needed?
You mean just to remind them to take their medication? Oh, absolutely.
And is it 7 days a week?
Yeah, so 7 days a week. They get a free daily call.
And the VA benefits, do you guys work specifically with aid and attendance, helping them get that if they're already qualified? Some people qualify and these people want to charge them when they literally are qualified.
Yeah, we don't do the application process, but we would help them connect them to resources that do. And so that they shouldn't be paying for that, obviously, we know that. You can, if you have the resources available and you want to get signed up, but you don't have to.
Just yesterday, I referred someone to 211, and the situation was that it was an elderly person that was disabled. He's getting evicted, and he wanted to know what steps can he take, and I said, talk to 211. So I know you mentioned motel vouchers.
Sure.
So above that, where does that go?
There are lots of programs, and again, you know, I don't know 100% of what is available, but there are, there are private organizations, there are nonprofits that work with people to prevent that from happening. So, it could be a situation where, again, motel vouchers, it could be, I forgot what the name of the program was, like during COVID, there was all this federal money for, to prevent people from being evicted for that obvious reason. Now that, I think a lot of that has run out, but there are other resources that are out there. It just depends on the situation, it depends on what county he's in, where he's at. I think he's in E. There's a lot, you know, and again, I wish that there was I wish I had a magic bullet to say that I could solve the homeless problem. I can't do that. If I did, I wouldn't be standing here. I'd be a rich man. But there are some resources, you know, and no one should ever be, it's like hunger, you know, that's one of the things that we talk about a lot too, and food resources is something that happens. But if you go to all of the food banks right now, they end up throwing food away. Every day they have to throw food away because no one should be hungry anymore. No one should be homeless anymore. Unless it's a situation where they, you know, they choose to, which is, that's a whole other can of wax. But there are resources that are available regardless of whatever that person is going through. Yeah. Okay.
How long are the hotel vouchers? Is there a limit?
No, it just depends. You know, I don't know the specific details on what is out there, but I know that there are things. You know, sometimes it could be for a week. I've seen some for as long as a couple of weeks to be able to help that person transition. You know, it just depends. I hesitate to always give specifics on what resources, because again, it always changes, you know. We never know what organization is going to reach out to us and say, hey, we have this amount of money that we want to help these people with for this period of time. So it just depends. Yes.
So on the 988, how, I know that you can call or text that. So if someone texts 988, does it also come to you guys?
Yes, that's a great question.
So it's the same people, and then what if it's someone who is asking for that pushes option 1 that they're a veteran? Does it go to you guys or does it go to a different call center?
Great questions. All of those calls come directly to the database, to the resource center. And then they're all routed based on what they want. So if it is a person that is suicidal, then they go to those specific resource center specialists that are more qualified to answer those calls. If it is a veteran, then it goes to, that doesn't transfer to somebody else or to another organization. It goes to our resource center specialists that work specifically with veterans. Because, you know, sometimes when you need help, the hardest thing you can do is make that first call. So the last thing we want is to, you know, pass the buck along to somebody else and keep passing the buck. So we want to be that focal point of where people get the resources that they need. One of the questions that I get asked too is like, how long does it take to get somebody on the line?
It's quick, that's it.
It's very
Texting, I didn't.
and we have data on all of this. We're a data rich organization, and I don't, you know, when I do presentations, I don't necessarily like to bore you with that. The difference being that when I go to funders, they want that information. How quickly are your calls answered? And we have that information. So yeah, good. Yes.
I may have missed it, but is there for the tech savvy consumer to go to 211? Is there a link to bring them to specifically to what they're looking for before they even call?
Yeah, absolutely. You can, that database, like I said, it's on the website. If you click to Roman Treasure Coach right now, there's a button at the top that says Get Help Now. That takes you directly to, you see, oh, she sees it. You guys, you know, I'm not full of it.
You need a new husband.
Well, I mean, I might. Can you find husband out there?
How helpful are you?
I'm not sure that finding a husband is helpful, but anyway. Speaking as a husband myself. Yeah, you click on that and it takes you to the database and it has all of those thousands of resources that are available. And again, that's the one that's updated constantly. And it's the same information that the resource center specialist would use if you called and asked them for those things too. It's the same database. Yes, question.
If you have someone call and they are in an emotional crisis, not necessarily suicidal, but they you know, they talk to someone and then they're like, I really need to get some help locally. What do you guys, do you have like a list of standard referral sources? Do you tell them to call their insurance? What comes next?
So the obvious first thing is to help them in that situation. And then to connect them to the mental health resources that are available to them for the future. And I'm not sure that I mentioned this either too, along those lines. If you are an organization and you provide services to someone and you want to be a part of that database, you can go onto the website and do the same thing. There's a button that you can click on and it'll show you how to get added to that database of resources. And again, this is why I want to promote the online database versus the printed sheets, because we can know that those are updated. And we have this happen all the time. I'm trying to think who called me recently. They changed, it was a mental health provider and they now provide services to young people. So she wanted to make sure that our specialists knew that. So we had to quickly update that database, and then every time someone called in looking for help, they can go and see that information. So if you're on that, if you're not on that, you can click on it again, and there's a whole, the same thing, get help now. It'll take you through the process of getting added to that database.
Just a question, so, you know, so that person doesn't go down the rabbit hole of, like I do, I see that you guys have it all right here, but if you're calm, right? What if that person who's in crisis is talking to, I don't know, Steven, and then they feel comfortable talking to Steven, and then the next day, they want to talk to Steven again?
The same specialist?
Yeah.
Oh, no, that happens. Sure, that happens a lot. And, you know, and that's one of the things that we get to as far as our satisfaction surveys go. People call back and say, hey, I was really struggling, you know, and you helped me, and I want to, you know, thank you for your services. Yeah, absolutely. Yeah. I mean, it's not necessarily going to always happen because, you know, people do have lives outside the job, but, you know, if it's a possibility that they want to continue to speak to that same resource center specialist, sure. Yeah.
Funding, where do you get funding?
Another great question. Most of our funding is through area partners like the Children's Services Council, United Ways. Another large percentage of our funding are from private donors. And, you know, we're in the process of also so basically those are the two biggest ones, you know, private funding and also through partner organizations like United Ways. And in fact, the history of 211, it started as a subset of United Way. Now they're separate organizations and separate entities, but, you know, we do still get some of our funding from them. And then, you know, grant writing and on all of that other funding, research, and resources that are available as well. Yeah, great question. We don't get, you know, that, and that's one of the things that people say, oh, you guys are now 988, so you get all that money from the federal government. Guess how much money the federal government gave us when they created the 988 number? $0. And they expect us, and in fact, the call volume has dramatically increased since that number went into existence in July of last year, so about a year and a half, almost 2 years ago. And we've seen a tremendous increase in the number of calls as a result of that. So great.
Is they help available in a different language other than English?
Great question as well. English, Spanish, Creole. And I forgot what that's called for disability services. I forgot what that name is called.
TCAS?
Yeah, like so if somebody needs they don't have the ability to hear, they have that
It's
yeah, that thing. That thing, whatever that's called. Again, I told you I'm a technology person. Great, thank you so much. Let's hear it.
Was that a fantastic presentation? Okay, so again, you people out there that are not here, 211 important. You also heard about the 988. Okay, we've got a few things that we need to handle just at the end here. We're going to around introduce people, but did everybody like the breakfast? All right, so we're going to have Matt Baxter from Stay Safe.
Anybody missing their phone?
Okay, there we go.
Thank you. The most important thing that happened in my family today was when Maria said, did you get forks? Did you get donuts? Did you get, I'm like, no, not all. But I'm like, I'm a coffee guy, that's all you need. And I have a story that was very funny, not funny at the time, but funny to me. And I thought about coffee. In my company, Stay Safe Services, the whole function is to see, we want to make sure seniors and those with disabilities stay safe in their homes. So now that we have the hurricane season coming up, I really like people, and just this real brief talk, certainly saying what you need in case of a hurricane, in case of a power outage. That could be something like your medicines, your water, and your coffee. The reason I bring up coffee is I was in charge of different shelters in my previous career. Well, all the officers had power, so we had coffee. But for a couple of days, all the clients did not have coffee. You know, one of my officers walked out like a Lion King in the courtyard with a big cup of coffee. Have you ever seen zombie movies? So all the clients started gathering, zombies, take him over. Now granted, he was armed, but we were still scared. So fortunately, we got some coffee afterwards. Now, the reason I bring up the coffee is that's just one of the things that we don't really think of in case of emergency, right? So I really like you and your clients to start thinking, what happens when there's a major storm? We know there's a lot of storms that are predicted this year. Plan on not having power, plan on not having lights, take some steps now, encourage people to take action, encourage people to have coffee. Thank you.
Okay, we're gonna talk about events in a minute. We're just gonna go around the room and you can give a brief description about your company, what you're here for, okay?
Hi, I'm Maria Baxter with Stay Safe Services. We allow elderly people or anyone with disabilities to stay in their home longer as opposed to going to assisted living. We provide grab bars, poles, ramps. We come in your house, we'll do an assessment and take care of your loved ones. And I'm a private tutor and I'm a very good teacher. I taught for 20 years. And if you need anyone or you know anyone whose kids are struggling and they need any help throughout the summer, I'm your girl. English, reading, writing, essays, whatever.
Good morning. In case you ever do need community living, so John Dillon with Senior Care Authority, helping seniors find new homes in retirement community, could be assisted living, memory care, or independent living. Thank you.
Good morning, I'm Tamara Barnett. I'm with Baker's Life, full comprehensive retirement planner. I do life insurance, long-term care, financial planning for retirement income, and also Medicare.
Hi, Mary Scott with Great Scott Group, Keller Williams in Port St. Lucie, also a board member.
Hi again, Catherine Griffin. I'm a senior care coordinator for Pinnacle Home Care. We do Medicare, home health, and private and insurance also. And a board member, I'm one of the founders of Treasure Coast Advocates for Seniors, and now I'm vice president.
Good morning. Dana Foreman, notarized with care and fingerprinting with care, all your AHA background checks.
Good morning, everyone. Andrea Davis with Standard Touch Caregivers and a Patient's Choice Home Health, also a board member. And
Yeah.
sure, you can help.
Hey, good morning. I'm Jenny Fee with Treasure Coast Hospice, and we serve Martin, St. Lucie, and Okeechobee counties.
Good morning, my name is Lucas Gutierrez. Thank you for having me here. I'm with Paulina VIP Care Services. We provide in-home care for people with disability and also providing medical staffing. Thank you.
Hello, my name is Kimberly. I'm embracing level care. I provide long-term home care, and I also have an agency with APD waiver. Thank you.
Good morning, everyone. Jennifer Jimenez with Sea Branch Health and Rehabilitation. We do short-term rehabilitation and long-term care. We take Medicare and a lot of insurances as well as long-term care Medicaid. Thank you.
I hate microphones. Good morning, I'm Jeff Schutzel with Senior Helpers of the Treasure Coast. We specialize in private use services, Alzheimer's and Parkinson's support.
Well, Alex House, we provide wonderful, beautiful environment for people who have medical referrals from hospitals, nursing homes, and or hospice situations.
I also don't need a microphone. I'll hold it though, like a good girl. So I'm Dr. Sarah, I'm a psychiatric nurse practitioner. Most of you guys know me in the room. If you don't know me or if you have any questions, please feel free to ask. I provide, the practice is therapy focused. I can also do medication management. I am the mental health branch of Seven Comfort Mental Health. We have a primary care as well. And I do mobile visits to assisted living and independent living facilities. So if you have anybody that's in those facilities and they need some care, I do therapy. I, meet them where they are. I listen. I walk with them. I'm a nurse for many years. So if they need any nursing care, I kind of coordinate with their primary as well. And the biggest thing is that I don't take any insurances, so I don't have to answer to what the insurance company tells them to do. I can do what they need.
Good morning, I'm Jacqueline, social worker with Florida Blue.
Good morning, I'm Mary Adams with Alto Stewart. We are an assisted living memory care community, and we are the best kept assisted living and memory care community in the Treasure Coast.
Good morning, I'm Karen Schmidt, and I'm not new to the area. I came back, I was in West Palm Beach, and I work right at home, and we have companions, and it's nice to see everybody and old times again. So I'm happy to be here. Thank you.
Morning, I'm George Hub. This thing's weird.
Now you know why we didn't want to use that.
Yeah.
Anyway, I'm a elder law attorney. My firm is Proactive Legal Care, and I'm a board member.
Hi, I'm Benjamin with Aqua Home Care. We are a registry that serves basically all of the state of Florida. Except for the Panhandle, we're coming for you. I'm also a board member and I'm glad to be here. It's Saturday.
Now, what do you do for the board?
I'm the secretary.
All right.
Yeah.
All right. Okay. I'd like to just mention something very quickly. Alex Foreman and techie experts spending massive amounts of time to get this thing online, put this thing together with us. Okay, using a lot of his own equipment. So behind the scenes doing all this stuff, be working on some of this stuff after you leave today, so we can get it on our YouTube site, Treasure Coast Advocate Seniors YouTube site, our regular site, I mean, all of those places. So we can extend this information, this fantastic meeting with all this great information and you. And one of the nice things is, we'd like you to have to use the mic because what happens, we can hear you and hear it. But when you get into the video itself, they may not be able to hear you talking. So very important to use that mic, and I hate mics too. But I have two friends that are named
Thank you. Like Tom said, my name is Alex Foreman with Techie Expert, Web Design and More. As the name implies, I do web design, but I also do much more. If you need advanced backend automation, coding, you want your graphic design to be uniform across all of your social media, your website, your Google business profile, I can help drive more consumers to you and help them stay more engaged and convert more of them to your customers. So if that would be of interest to you, check me out on techie.expert. Thank you.
Okay, Andrea's gonna come up and talk about her massive, huge, unbelievable event. Okay, come on up, Andrea.
Hello, everyone. There is a event that we have last year that benefit Treasure Coast Advocate Seniors. And it's our second annual. We would like to have everyone in this room. We have postcards, if you can upload it to your Facebook site and send it out so we can get more, attendance. for the event. And also, we still have sponsorship position. So anyone who would like to sponsor, you could give me your card and I can send you a package by email. So you guys can be a part of it. This event is, the Roaring 20 Extravaganza, and it's gonna be September 21st at Treasure Coast Lexus. And, it's $75 for the ticket, and 100% goes to the Treasure Coast African Seniors. All the person, everyone who is partake of it, we're volunteers. So we don't get paid, we put our own money in to make it happen. So we're looking forward for your support, cause it's for a good cause. Cause there's so many seniors that need help, and we would love to help them, but we can't do it by ourselves, we need help from the community. Okay, so I'm looking forward for everyone help, please donate whether a basket that we can raffle, buy a ticket, invite a friend, invite your neighbors, have your neighbors, invite another neighbor, and bring them all in. We're counting on that because we need the money. It was nice seeing you all, thank you so much.
Yeah, I was at that event last year and had a blast, I think I threw out a knee, so I needed help, dancing, totally dancing, they had some, I'll call it fake gambling, right? So gambling, we had all kinds of stuff, a lot of donations were there, the food was good, company was good. We saw somebody that Catherine Wu, that he almost threw out the steps, he was dancing so hard. Hi, Catherine. We have it on video, yeah, we do.
Oh, gosh.
Should we show it now? Okay. Really, if you spell his name backwards, it's B-O-B, so, but I won't say his name. We gotta tell him. Okay, very quickly, two quick stories, gotta tell you the stories. So every client that Mary and I talk to, we make sure that we talk about this like in the first few minutes. Treasure Coast Advocate Seniors, every time. We bring brochures, we have extra brochures if you want some, and made a whole bunch yesterday, you'll have to fold them, but they're back there. And so Friday, we were dealing with a veteran. He's in New Jersey, his daughter's in another place, we're putting this whole deal together and sold the house to someone Friday night. So we thought we had the weekend off, we did not. We worked Friday, Saturday, Sunday, and Monday. So VA, he's gonna need some help, so we're gonna be getting that information to our group, all right, so they can help him. That's the first thing. So, yeah, we're realtors, but that's what we do. We're invested into this group. Second part, we sit down with some people. It took a while to put that deal together, and we're sitting, but the wife wanted to hear about our group. Why did she want to hear about our group? She used to be the CEO of a hospital. Okay? She has, once a week, has about 30 people in her house, a group, they go through some stuff. She's now selling the house, so that means that group is gonna need to maybe come here, right? Be part of our group. So after we went through all of that, she says to Mary and I, where do I sign up to sell the house? After we went, she wanted to give a whole presentation about Treasure Coast Advocate Seniors. We did. We went through it. And then we signed her up for $1,555,000 to sell the house. Okay? It wasn't about selling the house, it was about getting as much information and helping our seniors as we could. Okay, so Catherine, do we have anything to finish up with?
We have a couple giveaways.
Wow, let's give it away.
We'll let Matt do a pick here.
Take it away.
Okay, all right, Maria.
No, let's give it away.
Smallest house, mini one.
A little something for you. Okay. And there's two little packets of candy. Let me get up.
Okay, here comes the candy.
Good for
So,
It's good for your mental health. There you go.
That's
And
right.
it's small, so it won't hurt your hips too bad.
don't forget, there's more food back there, so if we got a fresh one in, you just let some food in your purse.
Okay.
From Dr. Sarah.
John Daly, certified.
Oh, Okay, just want to finish the,
One more.
more candy.
For the 3 o'clock.
But notarized can.
Okay.
Thank you, of course.
All right, share, right? Share all the great information we got today. Tom Scott, from TCAS After Seniors, and as we always say, we hope you have a great day.
If you need any.
Yes, yeah.